Hey there, this is Dr. Pam Perry, and we're here with another Speakers Magazine show. And to introduce you about Dr. Ann Hester. Who is Dr. Ann Hester? She is actually a board certified physician with over 25 years' experience who wrote the book Patient Empowerment 101. She basically, we're going to have a conversation about talking with your doctor in a friendly kind of situation where you're going to learn a wealth of information of what she does, how she speaks to people. It'll change your health trajectory because a lot of times we're talking to doctors and we're not really sure. I was reading something the other day. It was it was a show. It was called Painkillers, and one of the things on the Netflix show they says people really believe doctors more than they believe their parents, more than they believe their priests, and it's true because we rely on them because they went to medical school and they have all of the information about our medical health. And so in this book, basically, we're feeling vulnerable sometimes when we're talking to doctors, but this book will empower you. It's a fun read. Her book is full of pictures, charts, questionnaires. And really, a lot of times when we're talking to doctors, they can seem so boring, right? It's like these words are so big, we can't pronounce them. But uh, with Dr. Ann Hester, we're going to see that her talk about the healthcare is something that we all need because everyone goes to the doctor if you only go just once a year for your physical. So with that, I'm going to bring up Dr. Ann Hester. Good, good, good. So, Dr. Ann Hester. So, before we kind of get into the book and patientempowerment101.com and all the things at patientworld.net, tell us about why you decided to become a doctor. Everyone has a different backstory. So, we want to hear your backstory and give us a lead up to where you are today.
Absolutely. So my father was the first African American physician in Evansville, Indiana. And I grew up with people saying, "Hey, your daddy helped me. Your daddy saved my life. Your daddy did all these things." And I was so impressed by those big words you're talking about. Like, who learns that stuff? So he didn't know I was going to follow in his footsteps. He passed away.
Mm,
And after that, I decided I wanted to be a physician as well because being able to have that kind of an impact on people's lives, that was profound. And I
mm,
loved it. And I just
mm.
wanted to carry on his tradition.
And then he basically didn't know, but you basically were always a science STEM girl. You're a science, math,
I
that
love
kind
math and science.
of. Okay, there you go. There you go. You love math and science, and so you went on to school. Where did you go?
I went to Purdue University. I'm a Boilermaker.
Okay, and then from there, you really did your specialty in.
I am an internist.
Okay,
I went to the University of Tennessee in Memphis, and I graduated there. And I stayed there for a little while and did a private practice. And then my husband and I decided to move to the East Coast to start a family.
okay, and so explain to people what an internist does because there's different types of doctors, and so you said really, so when someone says you're going to see an internist versus you're going to see a family doctor, or there's so many different fields, so it can be
Certainly.
confusing. So I bless you
Okay.
for doing this book. So what does
Okay.
an internist do?
Internal medicine is another term. So a pediatrician would see kids, internists, internal medicine doctors see adults. So if you have a cold, no matter what's going on, you go to see your internist. Family practice physicians, they take care of adults and children. They do the whole gamut, which is
Okay.
basically what my father was. But a lot of people at this point, they either do internal medicine or pediatrics. Some of them do med peds, but typically they choose one or the other. And the other primary care doctors are OBGYNs.
Okay. So becoming a doctor is more than just becoming a doctor. So now at this point, you're running a private practice. So you're an entrepreneur as well. So you're finding that you've got to market, you've got to how do you get your clients, I guess you would say? How did that come about? Do they know
Oh,
about you? Do you conferencing and
I did so many things. I did health fairs. I did things through my church. I did marketing. So now this was back in 1995. So this was decades ago when I dealt with private practice, and I was
so social media wasn't a thing. So you couldn't do YouTube, right?
marketing was frowned upon for doctors back then.
Yeah, yeah. And now I just saw a doctor. It was during the coronavirus, where I saw a lot of
Mhm.
doctors giving tips and that kind of thing about the COVID-19 and all this and that.
Mhm.
So that's how people found out about it. So, what became the genesis for you to really talk to patients about what it is that they need to know from their doctors, how to find a doctor, how to understand all the terms, how to prepare for visits? I mean, what does the person need to do to prepare for a visit? Understanding the power of what a health advocate is.
Mhm.
What made you, and then the insurances. There's a whole lot about the insurances,
A
right?
ton. So I have delivered babies and I have pronounced people dead. I have
Mm,
held their hands, sat by the bedside as I told them that they had a terminal diagnosis, and I've
mhm,
discharged people from the hospital that we didn't think we were going to live. Done the gamut. There is a huge void between how doctors think and how patients think. We've had a very paternalistic healthcare system where the doctor would say, "This is what you do," and the patients would say, "Okay, sure," and they would go home. They may or may not do it. I actually wrote the first rendition of this book in 1999. It was published by John Wiley in 2000.
mhm,
It
mhm.
was called Your Family Medical Record, an interactive guide to getting the best care. But back then, people didn't want to be empowered. They said, "Well, my doctor would tell me what to do, and I'll just do it." Fast forward a couple of decades, I thought I would try it again because people have changed to the point that they want to know. They want the power. They need the tools. And so I put another 20 years of practice into that, some of the best parts out of the other book, and I published Patient Empowerment 101, More Than a Book, It's an Adventure.
Mhm.
People need to know how to communicate with doctors. I once timed a lady. I asked her a yes or no question. It took her 10 minutes. I just said, "Oh, keep talking," because I was just curious. 10 minutes to ask a yes or no question. We're looking at a physician shortage of up to 124,000 doctors in 11 years. And
Wow.
if you consider the unmet needs of people in rural America and a lot of urban areas, it could be over 180,000 doctors. So just take that in. In a few years, those short visits you see now,
You're short and
nothing
sweet.
like what we're going to see. Each, just primary care doctors alone, we're talking about at least 48,000 doctors short. It's
Mm,
going to be hard to see doctors, and patients need to know how to go in, hit the bullet point, tell the doctor what she needs to know so the doctor can kind of pinpoint the potential diagnoses instead of being completely in the dark about what to do next and just think, "Okay, time's up. Let me order this test, this test, this test. Go try this medicine and maybe this. Come back and see me in 2 weeks." That is concerning. And that has been happening for a long time. When doctors do not understand what's going on, then they spread a wide net. If they have two, maybe three potential diagnoses, then they order targeted tests. They spend less time with you because they can get to the answer quicker. And instead of ordering medications, prescribing medications that have side effects, that interact with things, and that cost an arm and a leg, they can get the right diagnosis quickly and order the right drug quickly. So
mm.
there are so many things that can be accomplished when patients are given the tools to communicate with doctors on an unprecedented level, and they deserve
And it's when you said that there's going to be a big mass shortage of, because already when you go to see the doctor, they don't have a lot of time to sit and chat with you and this kind of thing. And it's a shame because it's based on time. It's I think the system itself probably needs just an overhaul,
that.
uh, just because of the way it's built and all of that, the economics of it, right?
I agree. I
It's just that's the way it is. But the thing of it is that you want to empower the patient so that they can get the way the system is now the most out of it. So when you
Yeah,
go to the doctor, if there is, I don't know how you feel about, is it WebMX,
that
Web
is
at WebMD, right? So now everybody feels like, oh, I'm my own doctor, right? Or do you, how do you feel about people going to WebMD before they come to you and says, well, I think it's this or that, I read this or whatever. How does that how does it make you feel? Because you've been practicing for a long time. So before it was WebMD, people were just kind of figure out, well, I think it's this because I talked to somebody else. So what is it? How do you feel about
WebMD is a reputable site. I go to WebMD. It's a very good site. But that being said, ultimately, when you sit down and talk to your doctor, you all are going to go back and forth about what's going on with you. It may sound like it's this condition, but once you talk, it's clear that it's something else. So, what I would like to do is just give everybody a few tidbits of information.
Okay.
This is important. If you have a pencil, write these things down.
Okay.
There are 8 key terms that doctors used to be mandated to use up until January of this year. They had to document this in their record, a certain combination based on what they charged. If they charged the insurance company a high level and they didn't document enough of these, they could be charged with insurance fraud. It was only
Mm,
recently that they pulled back on this. So it's not only important for insurance reasons, but it's important because these things help the doctor figure out what is and is not going on.
mhm,
So,
mhm.
number one, C, context. What's the context of your problem? Such as, I developed back pain an hour after I lifted a heavy sofa. You tell the doctor that he's not going to order an MRI looking for cancer.
Right.
C, character. Think of a good descriptive term. My chest pain is squeezing, it's tight, it's burning, it's sharp. Those things mean something. A typical heart
Mhm.
attack is an elephant sitting on my chest.
Yep.
Typical heartburn, it is the burning sensation. If you have a
Okay.
sharp sensation, it could be anything from your esophagus, it could be a blood clot in your lungs, it could be a pulled muscle. So that's important. Location, be specific. If you say, I have belly pain, what do you mean? You have so many organs in there. Is it the upper right abdomen but below the ribs? Is it the lower left abdomen? Is it the
Mm,
middle of the abdomen? Be specific. The same with the chest, the legs, or anything. Let them know exactly what you need.
mhm, mhm.
And then you have severity. On a scale of 1 to 10, 1 is mild, 10 is childbirth. I saw a patient once, he was texting, watching TV. Okay, so what's your pain? It's a 10. No, that's not a 10. A 10 for a man would be like you've broken some bones. For a woman, it's like you're in the midst of childbirch.
Okay. Yeah, some people are dramatic, so they're gonna say
Exactly.
everything is a 10.
But you,
They're just trying to get the attention.
you're
So,
right.
but
But the
yeah.
doctors will soon see that person doesn't really understand what's going on, so you lose credibility that way.
Mhm,
You want to
mhm,
walk into the doctor's office, have them sit up, pay attention, and at the end ask you if you're in the medical field because you got it. You got it
mhm,
going on so well. Okay, then you have T, timing. Each time it happens, how long does it last? For instance, it lasts 2 minutes each time it occurs. So A, associated signs and symptoms. I have nausea and vomiting with my stomach pain. D, duration. How long have you endured the problem? It's been
mhm,
going on for 2 months, but each time it occurs, it lasts a few hours. So we have
mhm,
duration and timing, they're different things. And then M, modifying factors. What makes it better? What makes it worse? If you say, I develop squeezing chest pressure when I walk more than 2 blocks, that tells your doctor something.
mm,
So those are terms that are very important. And I once spoke with somebody, actually just a few weeks ago. She used those things. She went to the emergency room. She had pain in her belly. She pulled out her phone, went over those things. The doctor diagnosed her quickly, and at the end, he asked if she was in the medical field, and she just started laughing.
Oh my god,
It's an
and that was just
insight.
them that being empowered and from
Exactly. The
oh my
tools are there. We just have not shared them. And so
mhm,
that's my goal. I call myself the physician on a mission to empower people
I
because
love that.
everybody needs this information. It's not just for doctors and nurses. We have one life, and we need all the information that we can get to optimize.
Mhm. Do you find that people who are coming to you often, there's hypochondriacs, right? And so they're
Mhm.
reading all the things and they're feeling like they have all of the diseases. If something is going around, if they have a sniffle, they have COVID. If their stomach hurts, they have gallbladders. I mean, so how do you help people who feel like everything that is going around
Mhm.
that they get? And it's something that you can at this point you're a medical doctor, but then it's like, do I need to refer them to a psychiatrist?
I'm chuckling because my daddy practiced decades ago. He would go through all the questions, and when they said yes, 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 he would say, "Does your urine glow in the dark?" Yeah. Like, okay.
So that is it. Everything, everything is wrong.
There you go.
Everything is wrong.
So you can't believe anything. I am an administrative physician now. I stopped practicing a couple of years ago, but I still deal with a lot of medical issues. But yes, I've had that so very many times, and so I just try to redirect, ask specific questions to try to go down a specific path.
That
And
is
so
wonderful.
when you do go to the doctor's office and you know what's going on, a red flag goes up for him. Unless you have developed a rapport that he knows that if you say something, he needs to sit up and pay attention. If you go in and you say, I had this, I read this here, I saw this there, you bring a stack of papers from the internet, he's going to go, oh my gosh, you're not going to see this.
Right.
But whenever he sees your name on the schedule, he's just going to cringe. So
Yeah.
you want to develop respect. You want that doctor to say, when she comes in, she's going to know what she's talking about. I'm going to be able to expedite her care and go on to the next patient who may need the extra time. I don't have to spend with her because she's so good.
hmm And so we always say, even in business, the best clients are the educated clients. The best
Mhm.
patient is an educated patient. Obviously, they can't be so educated about medicine because it's you can go to medical school, but patient empowerment one-on-one gives them the education that they need. Really talks to them, knowing different terms that they need to understand. And then you have something else too, doctor, that people you want people to know about. You're kind of building out as well. I think it's
Patient
patientworld.net.
World, mm-hmm.
Mhm. So
patientworld.net.
so tell us
So
about that.
I published Patient Empowerment 101, More Than a Book is an Adventure, in November. And then I was thinking, everybody doesn't like to read a lot. Let me bring this to life. And so I did a course on patientworld.net about patient empowerment where I actually hired some actors and actresses to play out certain parts of the patient so patients could understand how things go back and forth. And I go over a lot of detail. But I
Mhm.
also partner with a variety of other physicians and experts. They do courses as well. These courses are very down to earth. There are overlays of text, pictures, sometimes videos. There are PDFs people can download. There are even some crossword puzzles and other things. There are questions that come up on the screen that you need to answer to make sure you're paying attention. So this is all at a level that anybody can understand. I had
Mhm.
the world's only interventional cardiologist who is a culinary medicine professor and a professional chef and a variety of other people. And it's all about educating people on an unprecedented level so they can fully understand things. It's not me, doctor, you patient. This is we are one. You need to understand what's going on. And let me give it to you in a way that's enjoyable, that you're going to remember it. So
Mhm.
that's what patientworld.net is. And
Mm.
new courses are going to be added regularly.
Good, good. But patient empowerment, there's something there that people can download. They can get on your newsletter. There's different. Tell them what they will find at Patient Empowerment One-on-One. Because looking at it, it's not just where they can get the book, but then they can also look at the other things that you have that you can download there as well.
So if you have the book, then there are some internal pages
The
at
bonuses.
patientpower101.com where you can actually write some videos. You can download charts such as if you develop chest pain, start thinking about these things. The doctor's going to want to know them. So you're not one of the patients who spends 10 minutes trying to explain it. By the
Yes,
time you walk to the doctor's office, you will already know the FAQs for chest pain and you can spit them out just like
I,
that.
I
So you
love
can
that.
download those things.
I love that.
And then in addition, if you scroll down the bottom, you can print off a one pager. And that's like your mini medical record. So you put
Right.
in the important things that you need to have at all times. You probably remember the American Express commercial, "Don't leave home without it." I
hmm
said, don't leave home without your medical records. You can be going to the mall and end up in the ER.
Or
And if
on
the
vacation somewhere in another
Exactly.
country. Yes. Yes.
Exactly. And if the doctor
Mhm.
doesn't have that information right on hand, you can get a medicine you can interact with. All sorts of things can happen. So you can download that form for free.
That is good. That people need that. I find that that is one of the main things. If you're going to a new doctor, you're going out of town, and people are asking you all this information, it's like I don't have it, and it's like okay,
Well,
now
now
we have
you
it,
all
and
of it is right there.
it's right there. So, in patient empowerment one-on-one. So now at this point, you've been practicing for a couple of decades or more. You're kind of like an administrative. role right now, and you're speaking. And so are you speaking at like different groups, like church groups, women's groups? What is like the ideal places where you like to share your message?
Everybody who has an adult is going to benefit from this. So one of the places I went was just um, it was a landscaping company, and so this is not a group of people with PhDs and so forth. The people typically maybe have had high school diplomas or not. Um, and I went through this with them, and by the end of our lunch and learn session, they were able to communicate on such a high level. And a long time after that, the HR director emailed me and said people were still talking about it. So any virtual conferences, anything in the Metro DC area, everybody has the potential to learn because we have a long way to go to empower people. You said that the healthcare system needs to be revamped. You're right. So
But
just
it's not.
imagine
Mhm.
if millions of Americans could expedite their own diagnoses, that would go a long
Yes, it is. And one of the main things what you said is that it's the lunch and learn. So I love that where you can ask the doctor anything. A long time ago, doctors used to make house calls. They don't have time for
way.
that today.
No, that's right.
But now you can really learn how to empower yourself, empower the doctor so that they can go through and make the diagnosis easier for you. And
Yeah.
just I mentioned it earlier on, it's something that I'm watching a series on, and it was definitely fictionalized. It was Painkiller on Netflix, right? And it talks about Oxycontin. And I don't know if it happened like that or not, but it makes for good TV, right? So that's one of the things. But the main thing is that it always talks about how doctors are paid to prescribe certain medicines. And I'm like, yeah, and that was like people always
One
think
is a lawyer.
and that was kind of like the genesis of it. It's like, well, doctors are getting paid to do this, and I want you to dispel that myth that that is not the thing that happens. That you're not getting paid a commission
Oh my
to
gosh. It
to
really said that?
to dispense oxycontin, right?
That's painful. It's painful. I've taken care of so many people at the height of this who were addicted to drugs. I spent most of my time as a hospital medicine specialist, and so many people came in addicted to these drugs. No, physicians are not paid to administer those drugs or to prescribe them. Now, that being said, there are crooked people in
Yeah,
every field, and
in every
some doctors they had like drug mills, and people knew go to this doctor, he'll prescribe it for you. That is the norm, and a lot of those people are in jail for a reason.
Mhm, mhm, that is it, and that's one of the things that, the oath that people go through. First of all, you go through so many years of training, and then you take an oath, and then, there's more good doctors than there are bad, just generally, because they go into it for a reason. Your
You don't see
reason,
so many.
you want to save lives. I mean, you saw the impact your dad had on people, and it's like, wow, that is one of the things. Now, your dad had to be pretty special because not knowing the age of you, but the age of him going to medical school probably before civil rights laws were passed.
Oh, he went to Meharry. He and my brother went to Meharry.
Okay, black medical school, love Meharry, and that was like one of the. I think it was. Is that the only black medical school, or is it
No,
two?
there's Howard. There are several black medical schools now.
And that the reason why we had to have the HBCUs is because they weren't allowed to go to the other ones.
Yes,
And that is one of the things. And so when people think about, if we have like the doctors that are second generation of that, think about what they went through way back when. And
I
so like
can't
I said,
imagine.
it had to be very special. My husband grandfather was a dentist,
Mm.
and so he was born in 1900. So just do the
Oh,
math of that. So by the time he was like really practicing, I mean, he was involved in NAACP. So not only the
wow.
stress of black doctors dealing with the medical system, but they're
Mhm.
also dealing with racism as well.
Yes.
So now they're in the community as well. They're probably working with NAACP, and so white doctors don't have to do that. They just do the thing. They deal with the patients, but now they've got to deal with the other things. And that's really like the main thing. I just want to kind of like you bring out a little bit about your dad, because it wasn't just like, oh, I'm gonna go to medical school to be cool, but he's probably at this point involved in the movement. Probably
He was
involved in the movement.
very active. He was on the PTA, the school board in Evansville, and we were the first Black people at Harper Elementary School. And I used to
See?
wonder why he was always the first person to pick up the kids. He was out
Mhm.
there when school ended, and I didn't realize he was afraid for our safety. I just thought he wanted to be on time. He was afraid.
No, it's that's thing. And it is education is very important. Like you said, you were a math and science girl, right? So education is really important. And the same thing with my husband's father, who was a dentist. He was on the school board. He was the first African American on the school board because they feel like education is the key, really, that equalizer. And so I just really applaud you for carrying on his legacy as well and continuing to help patients. Uh, empower patients because the health system, when you go in, it's almost like, okay, we've got to get in and out and in and out. And if you say the wrong thing, they could, and, there's, you got to wait another 2 weeks or maybe a month later to go
Hit the
back.
nail on the head. That's exactly the case.
It's like
Because
a
when they
month
don't
later.
know what's going on, they spread a wide net, and you want a narrow net. You want the diagnosis to be correct
Hmm.
early on. So
Hmm.
that's absolutely correct.
And that patient empowerment 101, they can get the book obviously on Amazon. They can go there and get more information in patient empowerment 101, but they can also go to patientworld.net as well, and they can
Yes.
learn more about you. And if they want to get you to come in and speak or do a lunch and learn, which is I think would be really really cool to do a lunch and learn, go to patient empowerment 101. The HR, you could be HR's friend because obviously the more your employees know about how to handle uh,
Mm-hmm.
things that to stay healthy, the
Mm-hmm.
better it is for the company. So HR wants to keep their employees healthy so they're not always taking off sick. And so
Mm-hmm.
that's one of the things that really can help people as well. And an internist is that person, like you said, is an adult, a person, anyone, it's more or less like general things
Mm-hmm.
that you can learn as well. So I just really, really appreciate you and thank you for doing what you're doing because you could just be good and say, you know what, I'm gonna just go and sit down and
Mm-hmm.
have my
I
medical
can't
degree and
do
have a
that.
good life. But it's something in you that says, I want to make sure that until
Absolutely.
they fix the healthcare industry, we want to make sure
They
that,
need it. I still can't
mm,
give up. There's
yeah,
just always going to be something to be done. And if I may, if they go to patientworld.net/health hacks,
health acts.
uh, they can sign up for health hacks so they can get important information delivered to them regularly.
Oh, cool, cool. Yeah, that's the main thing. So I just appreciate you for doing this. It's a you got the reviews and everything on the book and everything, but like you said, you've been doing this for a while and just feel it was really more needed, probably past the pandemic, seeing that more people just needed more information because they were scared. People were scared, and so this empowers people. So I thank you so much for
Thank you.
doing all the things and really spreading the message about healthcare and how people can really feel empowered talking to their doctors and not be afraid. And not be afraid. Thank you
It's
so
been
much.
more than my pleasure.
All righty. Thank you so much. That was Dr. Ann Hester. She is Patient Empowerment 101. Want to book a lunch and learn or just have her come in and speak to your organization, your church? She's available to do that. So make sure that you go to Patient 101. And with that, I'm Pam Perry and I'm out. Thanks a lot. All righty. Bye bye.